I'm excited to introduce a new member of our team who will be moderating our first panel of the day, creating a healthier society, how health, nutrition, and the arts play a role in addressing the loneliness epidemic. Morgan Bailey just joined us a couple of months ago as our new policy director at the Foundation for Social Connection Action Network, and I'm delighted to have Morgan come up and join me right now. Morgan?
Yeah, well, let's want to have as well. Hi, everyone. Working? No, yeah.
Yes.
Yeah. Mixed signals. All right, well, while we're getting settled here, again, as Andrew said, Morgan Bailey, I'm policy director here with the Action Network, and I'm very pleased to be moderating today's panel with an impressive group of folks up here. So first to my left, we have Josh Protas, Chief Advocacy Officer with Meals on Wheels America. And then in the middle here, Dr. Jeremy Novell, President and Founder of the Foundation for Arts and Healing and faculty at Harvard Medical School and Harvard School of Public Health. And then finally, last but not least, Dr. Nicole Stout, Senior Director of Survivorship and Wellness with American Cancer Society and adjunct research faculty at West Virginia University Cancer Institute. So, warm round of applause for our. So just with brief intros there, I just want to start off with a question for everyone, and we'll go down the line here. But obviously, you all are in unique sectors, so different from one another. So what does loneliness look like in your field or for the populations you serve, and how does that connect back to public health?
So, first of all, thank you so much for the opportunity to be part of this conversation. For Meals on Wheels America, we work to address the needs of older Americans. And for so many, they are isolated, they're alone, and not only in need of nutritious meals, but those moments of social connection. So Meals on Wheels programs for decades, for more than 50 years, have been working to address these intertwined needs. In addressing social isolation and loneliness has been a core part of the model for Meals on Wheels programs. It's a friendly visit. It's not just the food. And Congressman Ballant talked about the full selves, like the entire person that's so important. She talked about the head and heart being connected. I maybe add head, heart, and stomach. And food, and was so pleased about the social framework in the new report on food and nutrition. I maybe add the term nourishment that takes that a little further. And if you think about nourishment, it's not just the nutritional needs for individuals, but nourishing our full selves. And an important part of that is being connected to others. So we're really pleased to be able to continue to serve older adults, people with disabilities. Unfortunately, and we'll probably have a chance to talk about it more, there are far too many who get left behind. There's a significant funding shortfall. About 1 in 3 Meals on Wheels programs right now report keeping a waiting list. We have many more that are soon needing to start one. And you think about for a senior who is in need not only of just basic needs, the food to get them by, but also those points of social connection, to be told that, well, you're going to have to wait to get that help. Sometimes, on average, the wait list is about 4 months, sometimes as long as 2 years. That can be literally the difference between life and death. And just to be told you're going to have to wait to get the basic supports to sustain you, it's just devastating.
Well, first, thank you. It really is a pleasure to be here, and thanks everybody for showing up. I'm going to try to talk about the arts, as much about connection than belonging. But let me start. Hands of the people out there who are art lovers, enjoy the arts. Right. It's like all of us, right? So in addition to the academic work I do at Harvard, I lead the Foundation for Art and Healing. We're a 501c3. We've been around 21 years. Our mission is to explore, promote, and facilitate creative expression as a path to health and well-being for individuals and communities. We're best known for the work we do to use the arts to address loneliness and disconnection. We started way before the pandemic. It's called Project Unlonely. And it really looks at the arts as more than entertainment, more than distraction, which in many ways, and by the way, I love entertainment, but really the unique power to do four things: to engage our attention, to inspire us, the big ideas, to empower us to think we can achieve those big ideas, and ultimately to connect us. So a big part of our work in Project Unlonely is taking advantage of the growing brain science about what the arts do. And so they actually activate brain, mind, and behavior in some very connecting ways. But I also think it's important to demystify, what we mean by the arts, because then you can see how it's part of daily experience, right? So the big four in the art world are music, visual art, music, and movement, dance. So these are the traditional art forms that have been part of every culture since the history of recorded times. But the actual creative arts we do on a daily basis are much broader. The culinary arts, as John said, right? It's part of nourishment. So not just the biochemicals in the food we eat, but the aromas, the smell, and even the ritual and the ceremony about eating together. The second is textile arts. Again, worldwide, knitting, crocheting, quilting. This is what brings people together, and they do that. And the third, which I love, is gardening. Can I see the hands of the gardeners? So gardening is great. It's actually what a friend of mine calls the world's slowest performance art form. So we'll talk more about it in the panel, but I think, not about gardening, but about the power of the arts to connect. But the last thing I'll say is there's just compelling evidence now about what the arts do to address the negative effects of loneliness on the brain. So we now know through work done first by John Cacioppo in the 20s, sadly passed away, that loneliness actually impacts the brain in three really worrisome ways. First of all, as you get lonelier, the world looks more threatening, and you tend to back away. So people that otherwise you might have open conversations with look like threats. The second is you become much less rational. And so in navigating daily experience, then you don't have that reserve to say, well, that person looks threatening, but maybe they're just having a bad day. You just move to the third thing that loneliness does. It makes us more impulsive. So that's what loneliness does to the brain. The arts actually counteract, almost repair those brain activities. So there's now very good evidence that the arts actually increase empathy. So watching a film increases empathy. Stanford just put that report out about 6 months ago. So we now know that the arts, not just entertain us, but they actually remodel how we make sense of the world. And that's what we're basing all of our programs and our hopes on, and I'll encourage you all to hope along with it.
Thank you. Good morning, everyone. I'm Nicole Stout with the American Cancer Society. Thank you to Morgan and this committee and bringing us together. So I represent a specific subset of patients, individuals who are diagnosed and living with and beyond cancer. And cancer is a harrowing diagnosis, as you can imagine. We're talking about 20 million individuals in our country today living with or beyond that diagnosis. 2 million new diagnoses each year. So it's a large contingency in our population. And so when we think about that diagnosis of cancer, what happens when someone is diagnosed with cancer? Their entire life changes. Every aspect of their life. Their time schedule has to change to accommodate treatment. Their social connections change because they are now in the mix of maybe not being at work as frequent, maybe not being able to engage with their friends. When we think about this population and isolation and loneliness, really there's a spectrum that we see. When someone receives a cancer diagnosis, as I said, it's very stressful, it induces a lot of anxiety, there are a lot of decisions to be made. what we can start to see is individuals begin to pull back from the social network that they may have around them. They don't engage in the same way with their work colleagues, their family, their friends. But the other piece of this also is that their family and friends and social connections also sometimes begin to pull back from them. Cancer is scary. We don't know what to say to someone sometimes who has cancer. And so you start to see a bit of deterioration in the social network that an individual has. So that's one end of the spectrum for us to think about. How do we touch those individuals and create systems for those individuals to help them regain the connection? The other end of the spectrum that we see are truly those who do not have a social support network, whether it's because they live in an area where perhaps they have family, but they live hours away, right? I have patients who have 3 daughters and they're very attentive, but they live in 3 different states and they're average 4 hours away. So that individual has a network, it's very supportive, although they are not present to help to support that individual. And then there are others, even at the further end of the spectrum, who truly do not have anyone. So when we think about the services and the needs of those individuals, we, American Cancer Society, have to think very holistically. How do we help to create and support an ecosystem of services that can come around those individuals in their communities? Absolutely. And we have a number of services that do that. We have a 24/7, 24-hour, 7 days a week hotline that individuals can call for anything, information about their disease, just even to have a compassionate ear to listen to them. We have drivers that can take people to their appointments and help to support them. So we've created an ecosystem in the community. We need to broaden that tent. As the Congresswoman said earlier, the infrastructure needs to be better developed. I was happy to see our YMCA colleagues here this afternoon, later this morning, who will talk about their facilities as an infrastructure to create what I like to think about as the third space, right? We understand that concept of the third space, of the third place. The place that isn't home, that isn't work, that isn't the medical facility, but is the place that we can go and convene around bowling, softball, pottery. Individuals that we see today diagnosed with cancer, they don't want to go and sit in a support group. For some people that works. For some people they enjoy that. Sit in a support group when we talk about what we're all facing, the challenges we have together. But the younger generation, I'm a Gen Xer, my generation and below, we don't want to sit in a room and talk about all our problems. I'd rather go to a baseball game with some folks, and that's where we connect. So the idea that the third place, social connections and building those around common interests is really what we're looking to begin to develop. So expanding those community resources. The other thing that we're challenged by is all of the resources that we have many times we rely on people to come to us. They've got to pick up the phone and call us. They've got to tell somebody that they have a need. Guess what? The need is out there. We heard half of adults today are express some level of loneliness. So the need is there. We need to put ourselves in front of them. And so at the American Cancer Society, some of the solutions I'll talk with you about later involve us getting into the healthcare system, screening and identifying early when people exhibit a lacking social connection or tendencies towards loneliness or social isolation. So I'm excited to be a part of the panel. I do bring a bit of a different perspective, but I'm thrilled to be here and to meet all of you as well. And think about how we build this network and this infrastructure beyond maybe what we traditionally think of as the places to come together.
Thank you so much, all of you. I think as you can see, we have, again, diverse sectors here, and I know we'll hear from more in the afternoon as well as later this morning. But I do want to circle back to a few things that folks said here. So Josh, I know you mentioned the friendly visit. Can you talk a little bit more about how Meals on Wheels is prioritizing social connection in those visits and what that means for the folks? You talked about those who are left behind as well. What do we need to do to get to those folks as well?
Thank you for the question. So social connections are, as I said, really fundamental to the model of the Meals on Wheels programs. There's a network of roughly 5,000 local community-based providers, and community-based is really an important part of that. These are local organizations that know their communities, they're invested in their communities. They're driven by volunteers. So it's not just dropping a meal off on the front porch. It's building a relationship, it's entering the home of the older adult. For that volunteer who is routinely visiting, coming in, seeing their home environment, recognizing if there are safety or wellness issues, getting to know that person. So it's so much more than that meal. And unfortunately, we're seeing an influx of for-profit companies that are swooping in and trying to pick up contracts. And what they're doing, they're drop shipping frozen meals on the front porch. So they're providing just a meal. And what gets lost is tremendous amount that social connection, that friendly visit, the eyes and ears that get to see the environment for the older adult, to recognize if there are additional needs, to be able to make those referrals and connections to supportive services. We're also really pleased, we have an innovative partnership with PetSmart Charity, where we are helping to support pets for older adults. And it's so powerful that those pets are a tremendous source of companionship. And unfortunately, for many low-income older adults, we have heard from many of our programs that seniors will report that they will give up some of their own food to support their pet if they can't afford pet food. So we're really pleased to be able to have this partnership to be able to provide pet food and additional supports to enable older adults to keep their opinions, that just help to give them that constant reassurance, in addition to the volunteers and the meals and services.
I love that, and I feel like that's a great example of how it sounds simple, maybe now to us, and it represents great innovation. I think that's wonderful. And just on that note of innovation, Nicole, I wanted to circle back to you because I know ACS has a lot going on here in this field as well. Can you talk, and feel free others to jump in at any point, but can you talk a little bit more about what ACS is doing on that front?
Yeah, so I'm going to take us into a little bit of a different dimension as well, because at the American Cancer Society, we talk about ending cancer as we know it for everyone. And when we say every cancer and every life, that's what we mean. So that isn't just the patient, that's the caregiver. And how do we define a caregiver? Really, it's anyone that touches the patient or comes alongside that individual to help to support them. Sometimes that's sitting with them and having a conversation, giving them a ride to an appointment. But the caregiver aspect in caregiving in cancer is complex and it's challenging. And so some of the things that we are looking at are stepping off into developing programs that help to create a network of caregivers and provide support for those individuals to meet their needs. Because the caregivers also, even though they're the spouse perhaps of a cancer patient, they become socially isolated and lonely. They have to step back from work, their social engagements to support their loved one with cancer. So we are stepping off this year with a large and expansive program in caregiving, and we are looking to take that to the communities, but also to the hospital and healthcare systems, which is why some of the legislation that we're seeing is so critically important around defining and measuring isolation, social isolation, and loneliness. In healthcare, if we can measure it, we can determine if we can change it, and if we can determine that we can change it, we can pay for it. We can create a rationale to get the services covered. So those are very important metrics for us to see come to fruition. So some of the innovative things we're doing, we are developing caregiver programs within cancer centers. This is derived from some of the great work that we have seen in the Alzheimer's and dementia community. Literally a program, a system of care within the cancer center that screens the caregiver to understand their needs and brings alongside resources to help to support that individual in supporting their loved one. So many times when we talk to a caregiver, we think of them as the second set of ears in the room. here, you must need this information about the diagnosis or the side effects or the things to watch for. But what about that person? What about their anxiety, their distress? So we're targeting those individuals specifically. We have an emerging challenge in this country. We have novel, innovative therapeutic modalities, specifically immunotherapy, some of the new sexy cancer drugs that you hear about on television every night. They require very particular procedures, and they require, FDA guidance requires that a patient have a caregiver alongside them 24/7 for up to 4 weeks in order for them to receive this therapy. Now, these therapies are life extending or life saving. And right now, the data show us that about 20% of individuals who qualify for this type of therapy are denied therapy because they don't have that 24/7 caregiver. So we have to think very innovatively about how we alleviate that gap. We bring someone alongside that individual as a caregiver 24/7 for up to 4 weeks. So bridging that gap, I think, is a key to solving some of the social isolation and loneliness issues that we talk about and we're all experiencing. But that's a focus area for us to help our patients, to help the caregivers, and to save lives ultimately.
I think so.
Of course, yeah.
First of all, Nicole, it's great you're focusing on family caregiver. And I want to acknowledge, and maybe people have a general sense of it, but because of these breakthroughs in cancer treatment, cancer is becoming a chronic illness for many people, and we're not prepared for that. So I'm an internal medicine physician, and even in like the 25 years of my practice span, I saw cancer turn into, for many people, a death sentence in 18 to 36 months to a chronic illness. And we don't prepare them with the skills and the tools to navigate that, or their caregiver. So it's a huge opportunity. And it takes us into the realm of chronic illness and loneliness, which is much bigger than cancer, of course. So cardiovascular disease, 50% of Americans will die of cardiovascular death. So the American Heart Association came out with a policy statement just 2 years ago saying loneliness increases risk of heart attack, stroke, or death from either by 30%. So you just do the math, half the Americans, 30% association. Even if we're 10% effective, we're going to save millions of lives and countless number of dollars. And somehow, in the enthusiasm we have about loneliness, we often forget how important it is to quantify the benefit, because policymakers have to evaluate the trade-offs between investments. And I think the biggest example of that is actually in dementia care, where dementia costs HHS $100 billion a year in direct payment. We know that loneliness increases risk, or is an attributable risk for dementia of 40%, 40. So if you take 40% of 100 billion, that's 40 billion. If we're only 10% effective with our intervention programs, that's $4 billion that can be transferred to community support services, because that's really where you need to focus in Alzheimer's. And so, we've got to do a better job, I believe, in the advocacy world for loneliness and isolation, is quantifying the benefit for the policy teams, because then it makes it much easier for them, not just to imagine going forward with the policy, but to make it a bipartisan issue, particularly when there's so much pressure on budget. So let's not miss that opportunity.
Yeah, absolutely. And I know, as Andrew mentioned earlier, we've seen, bicameral, bipartisan legislation and interest on this issue, which is always wonderful to see. But I want to stay then with this thread on policy and in particular barriers that you all are seeing, and what policy solutions are there that we're not leveraging right now, and how can we do better? So whoever wants to start us off. Or I can call them both.
Happy to. I mean, it'll be pretty simple, when we're talking about Meals on Wheels, funding has been huge. And want to recognize, Andrew mentioned the attention in recent years about the issues of social isolation and loneliness, and the legislation that's been introduced to measure, to provide definitions. That is huge. But we also have to support funding for what we know works. We can provide nourishing meals and points of social connection for an older adult for an entire year for roughly the cost of 1 day in a hospital or 10 days in a nursing home. We know that by providing those meals, the points of social connection, that we can help older adults to remain independently at home, to lead healthier lives. It's a smart investment. We save a tremendous amount in preventative care by alleviating very costly usage of emergency room visits, of hospitalizations, of placements in nursing homes. But we need to make the investment to do that. Funding has not kept pace with the growing older adult population, not by any means. So we have significant waiting lists, and those waiting lists are not only personally devastating for those who can't get the support they need, but they cost our country billions of dollars, hundreds of billions of dollars, really. So making sure that we're investing the money in programs that we know make a difference. They work, they transform lives, but they also realize significant savings.
Maybe I'll stay on the funding theme, because I think that is, I mean, so I'm in the Department of Health Policy and Management, so I think a lot, and I teach health policy course. It comes down to two things. This is what policy does. It does funding and it does regulation. Right, so on the funding side, I think we need to be more creative about funding targets for social infrastructure. So we've heard third spaces acknowledged. We imagine people are going to come together and share their stories. Where are they going to share those if we don't give them places to share them? And investing in, we might call civic infrastructure. We've already named several of it, libraries, museums, community centers. These are out there. These are organizations that want to be community centered hubs. And relatively small amount of funding, or at least not taking their current funding away, goes a long way. But the other thing we can do is think about private sector tax credits and investment in facilitating civic infrastructure development and engagement. So building tax credits, these kind of things. So we actually build the communities where people can have the storytelling, the shared ideation, and feel connected. I think we can do that. On the regulatory side, some very simple things. There's a welcome to Medicare visit that's paid for. Why don't we require that we ask on that visit whether people are lonely? It's a stigmatized topic. Just putting it into the conversation shifts people's thinking from loneliness being a flaw or an inadequacy they have to just another biologic signal. Like thirst is a signal we need hydration. Loneliness is our biologic signal that we need human connection. And if you normalize that, then people are much more likely to take advantage of the programs that are out there. And that can be done on the regulatory side, would be tricky to just mandate that as required. So we have to start thinking a little more creatively, if you will.
Yeah, I like the tie into regulatory because it's very sexy, and here we are on Capitol Hill, right? It's a cool place to be, and you go to your state legislature and you lobby and it all is great. But then everything goes to the regulatory front, and that's really where the rubber hits the road. So being able to engage with your state Medicaid, being able to engage with the Center for Medicare and Medicaid Services. How many of you have been to Woodlawn to be up on panels and discussions? Yeah, not many. But that's the unsexy part. But let me tell you about some breakthroughs we've had on the regulatory front with principal illness navigation, especially in cancer. Navigators has become a very critical piece of the cancer care delivery infrastructure. Principal illness navigation is the structure that we have set up to help to pay for. So we have specific common procedural technology codes, CPT codes, that can be billed for so that somebody on the healthcare team can get paid to do what's called navigating the individual. And that means helping to coordinate their appointments, helping to coordinate their test results, helping them navigate these insurance challenges and pitfalls, pre-authorizations. It takes a large burden off of the individual and off of the caregiver. But the other piece of navigation that comes alongside that is the screening of an individual to understand their health-related social needs. What is the financial burden that they're experiencing? Not necessarily about the cost of their drugs, which can be exorbitant. Are they able to get food on the table? Are they able to pay their electric bills, right? So financial toxicity screening as a part of navigation. Health-related social needs. Do they have access to groceries? Do they have access to an environment that is safe for them to exercise in? And if the answer is no, how do we connect them to the resources and the services using the navigator to help them to find and identify those social services of need? So the navigation, not just coordinating and supporting the individual through treatment with appointments and medical care, but this entire, connecting them to the entire ecosystem that exists in the community. Where are the social workers? Where are the extension offices? I live in West Virginia. We're in a rural area. Everybody knows their extension agents. Again, connecting them to the third place, maybe where those support services are available and necessary.
Some of you all serve primarily seniors or people with disabilities, but what does that look like with young people?
Well, I can step, so, Project Unlonely really serves three main audiences. First, older adults, plenty of loneliness there. The second is, the workplace, high stress workplaces, and almost every workplace has become a high stress workplace now, but certainly health systems, higher ed, you'll be hearing from my colleague and friend Connie Hadley about workplaces and loneliness in the next panel. But the third is the loneliest demographic, 18 to 28. And the Gallup Foundation did the research that it is now the loneliest demographic worldwide. It's not just the US. So whatever we're doing, we're exporting loneliness around the world. And part of it is the 18 to 28-year-olds are just unsure of where they fit in. So a really important part of our research is to show there are different types of loneliness. There's, I don't have a friend, no one to tell my troubles to. That's what most people think about. There's the loneliness of systematic exclusion because of race, gender, disability. But the third type of loneliness, I think, is what's impacting the younger folks, which is a kind of existential or spiritual loneliness. Does my life have meaning and purpose? Do I have consequence? And unless you have a narrative, a personal narrative, where you feel that, you don't, you're lost at sea, basically. I mean, Kierkegaard wrote about this. If you don't know where you fit in, you know, a word for it, it's like you're shipwrecked. And so what can we do to support younger people? And I think our programs are directed at that. We're now in over 50 campuses with workshops that the campuses deliver. So we're not a direct service organization. We build, test, and package program toolkits so that they can be replicated in a wide variety of community organizations. In part because that's the public health scaling model. We've got tremendous positive reception on campuses because the students not only want to be part of these programs, then they want to lead them for other students. Because the other thing that connects us is serving other human beings. We don't know the brain wiring of that, but if any of you have served, you know it makes you part of a bigger human story. And then you're not alone, you're part of the bigger human story. And you don't have to explain it to people, you don't have to kind of give them, you know, kind of white papers on it, you just give them the experience. So that's what we're doing for the lonely folks.
Well, and just to build on that, volunteerism is huge.
Yeah.
So many times, as we're on Capitol Hill talking about Meals on Wheels, younger staffers will say, oh, I volunteered for Meals on Wheels in college, or I'm volunteering now. I think that connection to others helps for that younger demographic to give a sense of purpose. But also interestingly, thinking about what the congressman just shared, you know, as you volunteer and you spend time with an older adult and you see their circumstances, it gives you an opportunity to reflect about what aging might look like for yourself and the choices that you want to make and the life that you want to live. So I think there are many dimensions to volunteering and that are beneficial not only for those that we're serving, but for ourselves as well. I was also thinking about his comment about Major League Baseball. How great would it be for a senior to go out to the ballpark with a kid, and for older adults who maybe have great memories of baseball games past or teams of their youth, and to be able to share something in that moment and make a connection and inspire connection to baseball for a younger generation. I don't work for Major League Baseball, so it's somebody.
Well, as you know, cancer does not discriminate based on age, right? Pediatric cases of cancer, adolescents, young adults, and we find that oftentimes these are the individuals who have phenomenal survival rates. Childhood leukemia is now upwards of 90% of them. We call survival rate. That's fantastic. They go on to live the rest of their lives in a changed body. They have fertility challenges, they have relationship challenges, probably one of the most isolated groups that we see. And so we do focus, we have an entire portfolio on what we call our Cancer Under 40 campaign, because these individuals are different. They have different needs than older individuals with cancer, and the relationships and the connections are a big piece of this. The other piece of it is the spouse, the caregiver, is sometimes a parent who also has significant challenges in isolating themselves to take care of their child who is dealing with cancer. So again, we need an ecosystem that addresses this need. To that point, and to the congressman's point, I think the way that we change some of this in healthcare is having someone genuinely open the door by asking the question. And I don't mean standing in front of their electronic medical record, going through the checklist, which they're now required to do because they get a quality MIPS payment benefit from saying, are you safe at home? Do you live in an environment that's noisy? Do you feel like you're anxious? Boom, 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 they go through the checklist. But really opening the door and asking the question to that individual sitting in front of you, how are you doing? And what that does is it gives that patient license to say, oh, my doctor wants to know how I'm doing, not about my disease, not about my tumor, not about the test result, the side effects, how are my kids doing? When we open that door, we give the patient license to understand that their medical team is beside them, not just for the medical care, but they walk alongside them to help to support that individual, bringing in the social support system that they need. Asking the question, how are you feeling? Do you have a connection? Do you have a network? And then we can then act on that, being able to act upon it and put them in places so that they can be connected with the resources and support services that they need. And I think there is no greater underserved population in oncology than those individuals who are under 40. This is a new and emerging space for us. It's a growing population. It has been the longevity of these individuals who live with cancer, side effects and sequelae in treatment. They feel very isolated. They are different, and we need to be able to create services that meet them where they're at.
And so we've talked about each of your sectors kind of in silos, but let's, in the spirit of building connection, let's go into some more cross-sector collaboration. What does that look like currently between health, nutrition, the arts, baseball, whatever it is, right? Or where do we need to be innovative?
I get excited thinking about some of the work that we're doing in this space. We have an entire food as medicine and oncology initiative that we are stepping off with. We have been a part of the food as medicine and oncology. We're working with Tufts University and others who understand that food is medicine for people with cancer. And so we screen individuals to understand if they are food insecure. That might mean they don't have money to get food. That might mean that they need education on how to cook healthy, nutritious foods. We have 31 Hope Lodges around the United States, and our Hope Lodges are places where people can get overnight stays. We are stepping off with a new program called Empower, and we are building those Hope Lodges out as a community locus of support to bring about nutrition elements, teaching kitchens, doing chef and cooking demonstrations, education, bringing exercise professionals into the Hope Lodges and creating those connections within the community. The arts, we would love to do more in engaging patients who are going through treatment. Many times they use that as a therapeutic modality to help them cope. Let's do an art show in our Hope Lodge of our patients who are using that, or their children perhaps who are using art as a means for coping. So we're really looking at how we develop that locus in the community that encompasses the support services, nutrition, exercise, the environment, walking trails within the communities, so that we can empower our patients and the caregivers and the support, that network that comes around them, to have those services in a setting like that that gives them stability.
Well,
And it builds a community. That's the beautiful part of it.
Would love to work with you
There
on
you
some
go.
arts-based program. But what I love about what the arts can do is it's fun, it's playful, and it doesn't take a lot of time or resources. And so what we're imagining is we could take, creative moments and integrate them into a whole lot of other programs. So we don't need new, like if you're a large corporation and you have health and wellness already, you don't need a belonging and connection program. Just add elements of belonging and connection to your health and wellness platform. So I think the opportunities are everywhere. And it comes down to what the arts actually do. So I mentioned what they do to the brain. The other thing they do in the brain, just creative making, reduces cortisol, right, the stress hormone, and increases the feel-good hormones, dopamine, serotonin, and oxytocin. So to begin with, you're relaxed and you're in a good mood. That's not bad as a way to connect with people. And it also makes the world look less scary, right? But it also invites you to share your story. And storytelling's come up, many times. I'm just delighted it's on the agenda and that for the Foundation for Social Connection, because what we're doing now and what you heard both of our congressional leaders tell personal stories. It's how we make sense of the world. We tell stories not just to be connected, but to be less afraid and to feel less alone. So let's just have more fun telling stories, and the arts do that. And then the third thing the arts do, and I kind of mentioned it, they invite us to be part of a bigger story, to see the world the way kids see the world, with a sense of awe and wonder and possibility. And we can package those and send those around as arts toolkits for Meals on Wheels. We can package them and send them around. As people, they go home from the hospital with those as little creativity follow-on toolkits to do with your neighbors, those kind of things. So that's what I really like about what the arts can do, because they're playful, they're fun, they're not intimidating. And you watch people making and sharing, and you see a kind of connection that's increasingly rare in our culture and in our society, and we can move them.
I see in the audience some of my colleagues from the Aging Network, and I'm cognizant in this moment, the Older Americans Act is facing some real challenges, and I want to just lift up that the Older Americans Act really is a beautiful piece of legislation that helps to address people in their full selves, to support older adults in the many different ways that they may need support, with programs and services that are coordinated to work effectively to meet seniors where they are and as their needs change. So the OAA really, I think, is a model for legislation that is not siloed. And unfortunately, we're dealing with challenges right now through reorganizations, staff reductions, through budget proposals about some parts of that aging network that could be eliminated, could face funding cuts. So I would just say, let's look at things that have worked effectively and support and invest in those. The Older Americans Act has really worked beautifully. Not perfect, but there are adaptations, improvements, new regulations that have built on what's been successful. So let's continue to build on what's worked effectively.
And I think folks, for those who have meetings on the Hill, receive some information about the OA as well. I think I worked with a colleague of yours yesterday on what that looks like in the future, so it's certainly top of mind for a lot of us there. And then I think we just have about 2 minutes or so to close out, but I'm curious, any closing remarks you all have, but also how can you encourage the audience here to engage, whether that's with your organization or just with the sector that you're representing more broadly? Whoever again wants to begin.
Okay. So I'll tell you a story about an event we did at our Baltimore Hope Lodge last fall. We had a celebrity chef come in, and we had about 60 individuals who were staying at the Hope Lodge and their caregivers. We had a musician come in and play for them. We had 2 local dietitians from the Cancer Institute nearby come in. What a phenomenal event and a social connection we created among those individuals. They're coming and going each day for their medical appointments. They might talk with one another in the common area, or they might not. But by bringing them together through an event, creating the third space, bringing together food, bringing together music, what a beautiful connection we were able to create. The energy in that room that night was phenomenal. The excitement among the staff, when are we doing this again? The patients and their caregivers, next time we come back, are we doing this again? It really is about catalyzing that opportunity for the engagement to occur. The social connections come once we create the space for those to happen, and once we give the license for individuals to come together and just talk as humans about what they're facing and what they're dealing with.
Well, I think that's really what it comes down to. We have to kind of expand the conversation around loneliness and break it away from the medical and medicalization of it. Yes, it is the biggest preventable risk factor for this classic triad of mental health challenges: depression, anxiety, addiction, suicidality. Yes, that's all true. I talked about the cardiovascular risk, but it's also an opportunity to really achieve thriving and flourishing at a human level. So let's tell that story to people. Let's invite them to participate in community-based activities. And bring food for sure. And bring music too. If you look at the brain with functional MRI scan, listening to music, every part of the brain lights up. So it shouldn't surprise us when we feel elevated with music, and it invites us really to engage with other people and to engage with ourselves. And so we just need more. I think the last 5 years have been tremendous in terms of the growth of our understanding about loneliness, its toxicities, and so on. And we're beginning to figure out what we can do about it. So now I think it's the time to move forward with some of those interventions, studying them, learning as we go, but not waiting till we have the full explanation, but just get going with what we already know.
We have to activate.
Yeah, definitely.
I would just encourage folks to show up for others, get involved, volunteer, whether it's with an arts organization, a community center, hospice, or delivering meals. I think connecting with another human being and giving of yourself not only helps that other person, but helps you to feel more connected to your community, to our world, and to yourself as well. And there are so many opportunities to get involved as a volunteer. There's so many needs out there. And the fact that you're all here showing up to talk about social isolation and loneliness is huge. And the more we can talk about it and model it through our own practice, not only in our professional lives, but as our personal selves, I think will be positive steps forward.
Absolutely, and I think Josh, you started off talking about this idea of nourishment, and I think it's a great way to come full circle because all of you just shared, right, the way that you can help nourish people beyond just food. And so I want to thank you all for being here today. That was lovely. I know we'll hear from some more folks soon, but I appreciate you all sharing today. Thank you so much.
Thank you.